Dr. Ken Landau. Thanks for watching. Let's talk about Rybelsus. Rybelsus is the first oral semaglutide for the treatment of type 2 diabetes. Same basic chemical as Ozempic, but Ozempic, you have to give yourself a shot once a week, and some people say, I don't want any shots. So now you can take the medicine in pill form. Belongs to the class of anti-diabetic treatments known as the glucagon-like peptide receptor agonists, GLP-1 receptor agonists. Rybelsus itself, that was approved in September of 2019. Ozempic came out in 2017, both made by Novo Nordisk. If you have diabetes, the first line of therapy isn't a medication, it's diet and exercise. So we have to realize that the vast majority of people with type 2 diabetes, those are people who are either overweight or obese. So weight loss is the way to go for the overwhelming majority of people. And if you lose the weight by going on a DASH diet or maybe in a Mediterranean diet or maybe a keto diet, cut down the calories, remembering though that not all calories are alike, more high fiber foods, more fruits and vegetables, more whole grains. If you do that, then you might be able to lose sufficient amount of weight so you don't need any kind of therapy for your diabetes. Maybe the diabetes just goes away. And physical activity is also very important. It helps prevent some of the complications of diabetes and theoretically improves your metabolism and can theoretically decrease the sugar to some degree, 150 minutes a week, that's 30 minutes 5 days a week. Principally aerobic exercise. Now most of us can go out and walk. Some people go out and bicycle or run or swim, that's all very good. Resistance exercise, well, add that on to the aerobic exercise. This is the weightlifting or the calisthenics. Increases strength and balance and increases your ability to perform the activities of daily living. But realize that most of us are sedentary. Most of us have a desk job. We sit down for the vast majority of time. Then we go home, sit down and eat dinner, sit and watch the television, go to bed, and in effect, we're not mobile. And as a result, it's suggested by some people that the cardiovascular consequences are somewhat akin to tobacco use. So you have to be very careful. Get your exercise. Get some kind of exercise. Well, the GLP family of drugs, glucagon-like peptide family, is very exciting. So now we have the Ozempic and now we have the Rybelsus, and right in front of the Food and Drug Administration at the present time is another drug, no special name, just semaglutide. And this drug can reduce body weight by somewhere between 15 and 20%. Now, unfortunately, it's going to be an injection, a once-a-week injection. And if it's approved, it's going to be approved not for people who have diabetes, but for people who are overweight. So theoretically, now we can prevent the onset of diabetes in some people. Well, if you happen to have diabetes and you've gone through the diet and the exercise didn't work, now you need some kind of medicine, Rybelsus isn't the first choice. For the overwhelming majority of people, metformin or glucophage, same medicine, first choice. And then we know that most people are going to need 2 or 3 medicines to control their blood sugar. And that's all because they're overweight or obese. But Rybelsus would be a good add-on medicine. Now, if you're going to take Rybelsus, you take it with 4 ounces of plain water, take it about 30 minutes before the first meal of the day. That means 30 minutes before any food or any other beverage or any oral medication. Because when you take the medicine, it's going to decrease the gastrointestinal motility. And as a result, it's going to decrease the absorption of medicine from the intestine. And if you're taking a medicine that has a very narrow therapeutic index, maybe a heart medicine, maybe an anti-seizure medicine, it could get you into some trouble. So you have to be careful. Clinical monitoring is very necessary. Now, if you wait more than 30 minutes, well, that's just going to increase the amount of absorption even more. We don't really need that, and all the studies were done with 30 minutes, so stick to that. Now, when you take the medicine, you shouldn't crush it or chew it or cut it. It's an analog of the natural hormone that we produce in the body. It has multiple actions on glucose. It's going to potentiate the secretion of insulin that's caused by the glucose being present. It's going to decrease the gastric emptying. It's going to promote the feeling of fullness, and it's going to act on the brain to decrease the appetite. Now, if we look overall, especially with the injectable form, same basic with the oral form, we're going to be able to reduce the blood sugar by about 25 to 30 milligrams. That's obviously very important. It's going to increase the stimulation of insulin from the time you see or smell the food, anticipation of the food, to the time when the food is being absorbed. Now, by itself, it's not going to cause hypoglycemia, and it's not going to interfere with the mechanisms if you do happen to become hypoglycemic because you're taking other medicines to boot. Well, that's obviously important too. Overall, it's going to be able to reduce your glycosylated hemoglobin. We talk about a normal glycosylated hemoglobin less than about 6.5%. Well, it's going to reduce your glycosylated hemoglobin somewhere between 1 and 2 points, so that's obviously very important. Causes weight loss, especially if you're on appropriate diet and exercise. Well, you can even lose weight if you're not on an appropriate diet. It comes with some warnings, black box warning for thyroid C tumors in rodents, unknown human significance. There's a question about medullary thyroid carcinoma, but that doesn't seem to be an issue in humans. But if you happen to have a history of medullary thyroid cancer in your family or personal history, then you have to be extra careful. Multiple endocrine neoplasia syndrome type 2. Again, be cautious if you develop a mass in the neck, trouble swallowing, trouble breathing, or persistent hoarseness. Obviously, go see your doctor. But no routine monitoring is necessary in the absence of any of those symptoms that I just mentioned. Well, Rybelsus hasn't been studied in patients who have a history of pancreatitis. It's not studied in people who have type 1 diabetes, not thought to work in type 1 diabetes because they can't make insulin, and the way the Rybelsus works is it boosts the insulin production. Also not good for people who have diabetic ketoacidosis. So how do you take the medicine? You take it orally, you take it once a day, you take 3 milligrams for the first 30 days, and then you increase it to 7 milligrams once a day. You do that for 30 days, and sometimes that's all you need. But if you're not controlled after that second month, then you can increase the dose yet again to the maximum of 14 milligrams a day. But 14 milligrams a day is not 2 of the 7 milligram tablets, because the medicine contains an oral enhancer, an absorption enhancer. And you don't want to double the dose of that. So you need, if you're going to take 14 milligrams, to take a 14 milligram tablet. You don't go and take 2 of the 7 milligrams. Now, pancreatitis has been reported. If you have symptoms of pancreatitis and the condition is confirmed, then stop the medicine and don't restart it. Signs of pancreatitis are persistent abdominal pain. Sometimes the pain radiates to the back. Sometimes it's associated with vomiting. We have an issue with diabetic retinopathy. So diabetic retinopathy is thought to come on in many patients secondary to a rapid decrease in the blood sugar. So if we look overall at people who have a history of diabetic retinopathy at baseline, we find that 8% are going to worsen if they take Rybelsus versus only 5% if they happen to take a placebo. But if a person does not have a history of diabetic retinopathy, it seems that it doesn't have any significant impact on the incidence. So we don't have to worry about that. Hypoglycemia, well, you could theoretically get hypoglycemia if you're taking insulin or you're taking an insulin secretagogue. That's a medicine maybe like a sulfonylurea, like glyburide or glipizide or glimepiride. So if you're taking those kind of medicines, you probably ought to reduce the dose of those drugs before you start the Rybelsus. Fortunately, it doesn't seem to predispose to arrhythmias. Now, after it's been out on the market for a while, it was found that there is a very small incidence of kidney injury or worsening of chronic renal disease, but most of those people were dehydrated, they had nausea, vomiting, or diarrhea. So in people who have risk factors, you ought to monitor them relatively closely. Now, if you happen to be taking the oral Rybelsus, let's say you're taking the 14 milligrams and you want to switch to the injectable Ozempic, you want to take 0.5 milligrams once a week by an injection, well, you start taking that medicine, the Ozempic, the day after you took the Rybelsus. On the other hand, if you're going the other way, and you want to switch from the weekly subcutaneous injections of Ozempic, then you wait a week after the last dose of Ozempic, and then you start taking either the 7 or the 14 milligram Rybelsus right away. Now, you don't consider that the drugs have bioequivalence. So, in other words, the 7 or the 14 milligrams of Rybelsus going to give you about as big a kick as the 0.5 milligrams of the Ozempic. So you wouldn't want to take a massive doses of Ozempic. So that's very important. Another thing to realize, all medicines have some side effects. Side effects tend to be basically the same as in most other kinds of medicines: nausea, abdominal pain, diarrhea, decrease in the appetite. Maybe 5 or 10% of the people, 5% of the people are going to have some vomiting or constipation. And then there's occasional abdominal distension or indigestion or GERD or gastritis or burping or passing gas the other way. If we look at gastrointestinal side effects with placebo, it's going to be about 20%, 30% with Rybelsus 7 milligrams, 40% with Rybelsus 14 milligrams. Tend to develop the gastrointestinal symptoms with dose escalation. Other than that, seems to be relatively okay. The likelihood of discontinuing the drug because of gastrointestinal side effects, relatively uncommon. Likelihood of hypoglycemia, severe hypoglycemia, tends just not to occur, even when you add it to other kinds of medicines. But the fasting blood sugar can fall into the 50 milligrams or even less, in up to 25-30% of the patients, but the body takes care of that and doesn't require anything special. Now, additionally, it's possible that you're going to develop an increase in the amount of pancreatic hormones, amylase or lipase. That's anywhere between 10 and 35%. Gallstone disease occurs about 1% of the people. It's possible, because it's a biologic kind of a medicine, that you can develop antibodies to it. And some of those antibodies are neutralizing antibodies, so they can theoretically stop the semaglutide or the Rybelsus from working. That only occurs in 0.2 or 0.2%. And the significance of those neutralizing antibodies is currently unknown. Now, the drug may cause fetal harm if a person takes it while pregnant. So the data right now is not sufficient to tell us about the birth defects, about the miscarriages, the other adverse, either maternal or fetal outcomes. So it's currently recommended that those women who are desiring to become pregnant, they ought to stop the medicine about 2 months or more before planned pregnancy. It takes a long time to wash out of the body. If we look at animal studies, it could cause structural abnormalities, embryo-fetal mortality, and it can interfere with growth. So medicine seems to have some adverse effect on pregnancy, at least if we're looking at the animal model. But on the other hand, poorly controlled diabetes in pregnancy is associated with an increased maternal risk, diabetic ketoacidosis and preeclampsia, and spontaneous abortions and preterm delivery, complications at delivery. So you have to decide what the most appropriate kind of therapy is. And there are standards for that. Now, it's estimated that the major birth defects occur if people have a glycosylated hemoglobin of less than 7, they're type 2 diabetic, somewhere between 6 and 10%. If, on the other hand, the glycosylated hemoglobin is more than 7%, as many as 20-25% may develop major birth defects. That's opposed to the general population, where the incidence is only about 2 to 4%. Now, breastfeeding, it's not recommended. We know that the semaglutide, the Rybelsus, can be in the milk of lactating rats. But of more importance is that absorption enhancer. And the absorption enhancer that's added to the Rybelsus, added to the semaglutide, so that it can be absorbed when taken by mouth, well, that's present in the milk of lactating rats. Well, the absorption enhancer crosses the placenta, reaches the fetal tissues. All that obviously is very important, and it seems to have a deleterious effect in animal models on the outcome of pregnancy. So it increases the number of stillbirths, it decreases the pup viability, and it increases the gestational length. Now, in pediatrics, the medicine really hasn't been studied, not effective, not recommended as safe and effective in children who are less than 18 years of age. Geriatric population, well, about 30% of the patients in the studies were over age 65, no change in safety, no change in efficacy versus younger patients. It appears that older patients might have an increased sensitivity to some of the side effects of the medicine. So be a little cautious, lower dose for perhaps a little while starting to take the medicine. If you happen to have renal impairment, it could be moderate, it could be severe. You might even have end-stage renal disease on dialysis. No modification is necessary in the dose, and if you happen to have liver disease, varying degree, no change in the dose is necessary. And if you have upper gastrointestinal disease, no change is necessary, even if you have chronic gastritis or GERD, GERD, gastroesophageal reflux disease. If you overdose, supportive treatment is generally adequate. It has a very long half-life of about a week, so you need prolonged observation. The backbone of the Rybelsus is produced in yeast fermentation, stabilized against degradation. It's degraded by DPP4, that's dipeptidyl peptidase 4. You might know that because that's what Januvia is. So it seems that the stabilization allows the medicine to have a much longer half-life. It allows it to bind to the albumin. It decreases the renal clearance. Now, if we look overall, it's absorbed about an hour after you take it. It's in the stomach where it's absorbed. Now, most of the medicines are absorbed in the small intestine. This one's from the stomach. Maximum concentration is about an hour post-dose. You get to a steady state after you've taken it for about 4 or 5 weeks. The absolute bioavailability is somewhere between 0.5% and 1%. More than 99% is bound to albumin. Half-life is about a week. That means you can find some in your circulation for about 5 weeks after your last dose. It's metabolized by proteolytic cleavage. That's of the peptide backbone. Then beta oxidation of the fatty acid side chain. It's excreted in the urine and in the feces. Only about 3% goes out unchanged in the urine. If you look at the dose necessary, the 7 to the 14 milligram dose, that's adequate for people who range anywhere between about 90 pounds and 410 pounds. Drug interactions, low potential to interact with the enzymes, so that's very good, but it can delay gastric emptying, and that can change the absorption of oral medicines. Now, if you take the medicine, it could be as sole therapy, but as I said, it's rarely used as the only therapy. It's used in addition to metformin, but you might take the SGLT2 inhibitors, Trulicity or Jardiance, maybe take sulfonylurea, or thiazolidinedione, like Actos. Maybe take it with insulin. It doesn't seem that there's any change in efficacy as far as males or females, the age of the person, the race, the ethnicity, body mass index, how long you've had the diabetes, whether you have kidney disease or not. Now, if we look at people who have inadequately controlled diabetes on diet and exercise, so now this is a monotherapy. If we look at the people and they have a baseline glycosylated hemoglobin of 8%, remember we want less than 6.5%. Well, after 26 weeks with placebo, there's hardly any change at all. Rybelsus 7 milligrams is going to decrease the glycosylated hemoglobin by 1.2%, 1.4% with the Rybelsus 14 milligram. The likelihood of having a glycosylated hemoglobin less than 7%, about 31% in those taking placebo, but about 70 to 80% in people who are taking the Rybelsus. So obviously Rybelsus is a good drug. Now if we look at a clinical study where people have a fasting blood sugar of about 160, look at the change in 6 weeks, we're going to find that the placebo decreases the blood sugar, the fasting blood sugar, by only about 3 milligrams. On the other hand, 7 milligrams of the Rybelsus, going to drop it by about 28 milligrams. 14 milligrams of the Rybelsus, going to drop the blood sugar by about 33 milligrams. Obviously, that's extremely important. And placebo patients, they're not going to really significantly change in weight if you take the Rybelsus 7 or 14 milligrams for the 26 weeks of the study, lose about 5 to 8 pounds. Now, if you compare it to Jardiance, Jardiance is an SGLT2 inhibitor, you're going to find that the medicines work pretty much as far as equivalence is concerned. Both of them going to lose about the same amount. Both of them going to have glycosylated hemoglobin fall by, in the Rybelsus family, about 1.3%. In the Jardiance family, 25 milligrams, by about a little less than 1%. But if we look at the percent with glycosylated hemoglobin of less than 7%, with Rybelsus it's going to be almost 70% versus Jardiance only 40%. Both groups are going to lose about 8 pounds. So if we compare it to Januvia, again we find that it seems to cause more of the people to have a glycosylated hemoglobin of less than 7%. Rybelsus 7 milligrams, 44% Rybelsus. 14 milligrams, going to be 56% decrease. Januvia, 100 milligram dose, about 32% going to fall into that area where we really would like them to be. And again, if we look at multiple different drugs, if we look at liraglutide, that's Victoza, well, they're both in the same family of drugs. And we find that those two drugs are relatively similar in what they do. So if you're not adequately controlled on insulin and metformin, then could Rybelsus add anything? Because after all, insulin is supposed to be the strongest drug. Well, yeah, it sure can. And as a matter of fact, if we look at the glycosylated hemoglobin and we look at what it does in people who are taking the metformin and the insulin, and then we add a placebo, the glycosylated hemoglobin is only going to go down less than 0.1%. On the other hand, if we use the Rybelsus, going to go down by about 1 to 1.5%. Obviously, that's quite significant. And if we look at the percent of the people who have the glycosylated hemoglobin less than 7%, well, in the Rybelsus, both 7 and the 14 milligram, going to be well in excess of 40 to up to almost 60%, versus only about 7% in those people adding the placebo. So, bottom line, the drug seems to work very well, and as a matter of fact, if it's studied as far as the heart disease is concerned, it seems that it doesn't increase the risk compared to placebo at all. So it's not inferior to a placebo as far as the major cardiovascular events are concerned. And as a result, I think we can easily recommend this as a drug that might seem to be extremely important as far as those people who want to avoid injections who'd rather take a pill once a day. Now, unfortunately, Rybelsus, both 7 and 14 milligram tablets, they're going to cost cash-wise somewhere between $900 and $1,000. That's just for a month. And if you have a coupon from GoodRx, it's going to be somewhere in excess of $800 to $850. But the company is going to give you a special deal. They're going to have a copay card. And they're only going to charge you $10 for 30 days. And you can then charge the rest of the money to the insurance company. Well, that's one of the ways they come out with such ridiculous prices for medicine, because they know people aren't going to be able to afford it out of their own pocket. So what they do is they just sock it to the insurance companies. That's inappropriate. Other medicines that are in the GLP-1 receptor agonist family that you've heard of are Trulicity and Victoza, Ozempic, Bydureon, and Adlexin. So if you happen to have type 2 diabetes not adequately controlled by diet and exercise, then some kind of medicine might be appropriate. And if you want an oral medicine, well, certainly you start with the metformin. But if that doesn't seem to work, then you add something else. And it would appear that the Rybelsus drops the sugar, drops the weight, drops the glycosylated hemoglobin. And it seems like either the GLP-1 receptor agonists, of which Rybelsus is one, or the SGLT2 inhibitors, those would be drugs like Invokana or Jardiance or Farxiga, those are probably the best medicines for taking care of diabetes, type 2 diabetes at the present time. So the big push for Rybelsus is it's a pill, so it's the only pill form of the GLP-1 receptor agonist family. And for those people who simply want to take a pill, this might be the way to go. It's expensive. And remember, the basic underlying cause of diabetes, type 2 diabetes, is your body weight. So if you pay more attention to the body weight, then you might not need any of these kind of therapies. You might save yourself a heck of a lot of money. And remember, along with diabetes come a variety of complications. Complications to the eye, complications to the kidney, complications to the cardiovascular system. So there's good reason to avoid diabetes. Anyway, thanks for watching. If you enjoyed the show, please tell a friend. Consider subscribing so you'll be notified as we post new videos. I appreciate your interest. I'm Dr. Ken Landau.